for this guest lecture on the topic Actify the Mental Health to Unleash the Strength of Physical Well-being. So, in this lecture, we'll be discussing about mental health and physical health, how they are related, and how health is a state of complete physical, mental, and social well-being, and also how mental health and physical health can help others, and it can influence our family status and economical things as well. This discussion is made to make awareness about the mental health to our VIT students. In addition to that, it will really help them understand what are the benefits that we have when we try to have good well. And about today's speaker is Dr. AMALA DEEPAN. He is working as an emergency physician in Kauvery Specialty Hospitals, Trichy, and he has been working in Apollo hospitals for last 3 years. And he has more than 8 years of experience in emergency medicine. He has also completed his fellowship in emergency medicine in Apollo Specialty Hospitals, and also has cleared Royal College of Emergency Medicine exams in UK. He also did observation in Birmingham City Hospitals, UK, and he has presented multiple articles and presentations in national and international conferences. And I welcome you, Doctor, for this guest lecture. You can continue, Doctor.
Thank you, sir. Hello, everyone. Good afternoon. So today we are going to discuss about the mental health and related to the physical well-being. I'm really, are you all really thinking that we all know aware of, we all know and we are well aware about that we are physically fit and is there a mental condition needs to be fit to get well-being of the physical? So today we are going to discuss about these things in a detailed manner, and what are all the things I'm going to discuss is like case study. Case study is the thing which I'm experienced in my emergency department, and I'll give you the two case scenarios, and second one will be the health types and dimension of health, and the third one will be the mental types of mental disorder, and fourth one will be the psychoanalysis, and fifth one will be the stress and types and management. So coming to the case study, a few years back in our emergency department, I reviewed a 30-year-old male who is an IT professional. He he presented with a history of confused speech and extremely anxious and loss of appetite, marked weight loss for past few weeks. So our staffs are examined her vitals, and we did some basic lab workups, and we did some brain imaging. Everything seems to be normal. So we are collecting further more detail from his family, and while collecting, we came to know that he is recently divorced due to some other issues and emotionally breakdown. And previously he was a teetotaler, but he consumes an alcohol continuously for past 1 week, and there is a couple of suicidal attempts also. So we came to know all the details, and we treated him with an appropriate drugs. And our hospital psychiatrist was involved, and she given a couple of counseling. After multiple sittings of counseling, he become normal and he was sent home. So this is a first case study, and I'll give you one more also. In this, a 45-year-old male, he is a government bus driver, presented to our hospital with a history of lower abdomen pain, burning maturation, and fever on and off. So, as previous scenarios, we examined him. We sent some basic blood investigations and lab reports. All it shows like he's having some urinary tract infection. So we are admitted him and we treated with a couple of antibiotics. Due to that heavy infection, he had a drop of urine output, and his kidneys are failing to putting out the urine. So we are in a scenario of putting him in dialysis. Once we are when he is out of the infectious state, so his kidneys are restarted, and we are off of we withdraw the process of hemodialysis. But when he's in the ward, some of his relatives told him that once if you are undergone dialysis, you won't live long, something like that. So we treated him and he's discharged, but he's having some idea of that the person who are all undergone the dialysis, they won't live long, something like that. So he oftenly visited to hospital with some non-specific complaints. Again, we will examine him, but there was a no alarming finding. Then we involved him with our hospital psychiatrist. She's also counseled him very well, but nothing worked. After a few months, he became extremely depressed, and he is no more. See, by reviewing these two cases, the main issue for first person, he doesn't have any kind of a disease, but the mental illness, the extreme mental agony made him to compromise his physical health. So the second scenario, he is actually having some sort of disease, but we are able to treat completely. He is rid of him. He is completely out of his physical diseases. But thing is, his mental illness, we can't able to treat him. That means the he is that means he won't change his ideas and thoughts, which is implemented by some of his relative. So by these two scenarios, we will cleanly know that the mental well-beings are foremost important for our physical well-being. So we'll move on to our topic and introduction. Health is a term that can mean merely many things. It can be used a large variety of ways in health. A physical education and a specialized term doesn't merely refer to absence of disease, but incorporate the physical and social, mental, spiritual wellness of an individual or a group. So, what is a WHO definition of health? Health is a state of complete physical, mental, and social well being, not merely absence of disease or an infirmity. So the term total well-being means it comprises of mind, body, and spirit. If anyone will become compromised, and any one of the thing is compromised, it automatically affect the others too. So what are the types of health? The two types of health mostly discussed are mental and physical health. And in mental health, it refers to a person's emotional, social, and psychological well being. The mental health is important as physical health as a part of full active lifestyle. So, what is a mental health about? Our mind, how we think and feel, how we express our emotions, how we perceive the world, how we react, how you act in order to face life situations, how to handle a stress, and how you evaluate your options and make choices, and how you relate to others. These are all things about the mental health. And what are the characteristics of mental health? Nothing called a perfect mental health. It is a dynamic concept actually. The concept of mental health is a subjective, and it depends on the sound physical health, adaptable, realistic mind, conscious control of life, cheerful, optimistic outlook, well regulated instincts, and emotionally balanced and socially adaptive, and healthy habits and attitudes. Physical health, we are much aware of physical health, that everybody, I mean, we all are taking, I mean, mostly we will take some good foods and adequate amount of exercise, so we are much aware of about the physical health. And what are the dimensions of health? The six dimensions of health are physical, emotional, intellectual, social, and spiritual. Each dimensions of health is incorporate many factors that can negatively or positively affect health. Each can be analyzed looking for ways a person might improve their all round health and well-being. The 6 dimensions of health are also interdependent and it is not independent. This means each dimensions can affect others. So all round of health is attained only when all dimensions of health are sufficient and balanced, and a health individual may experience a sense of wholeness. So coming to next topic. So what are the types of mental disorder? It is a personality disorder, or it is a panic attack, or maybe anxiety, or sleep disorder, or depression, or social anxiety disorders. Coming to the main core of our presentation, it is a psychoanalysis. So this man is we. I think most of us know about the Sigmund Freud. He's a father of psychoanalysis. So Freud created this disciplined manner of psychoanalysis, which is a study of an unconscious mind. So he introduced the many theories like the unconscious mind, dream analysis, octopus complex, Oedipus complex, and the concept like free association, ego and superego concepts, and Freudian slip. Freud used a technique in psychotherapy called free association. So it is a first. The free association says the first thing that comes into your mind, into your head without a conscious filter. Goal is to get all conscious processes. And coming to the dream analyze, it identify your true desire and worst through analyzing the content of your dreams. So this is his concept. So conscious mind is like an iceberg. The conscious is a small amount of mental activity. Actually, we know the subconscious is like the thing which we could not aware if we wanted or tried, and the unconscious will be the is immersed the things we are unaware and cannot become aware of. And the concept of it we will discuss clearly in next slides. So, what is the id, superego, and ego? The id is an natural impulses. That means our hunger, thirst, or going to bathroom, and it is also called as the pleasure principle. And the superego is otherwise called a moral principle, or whatever the society says that you should do in the situation, or what you believe that you are morally right. And coming to third one is the reality principle, that is called as ego. It comprises between the id and the superego to determine the behavior. And we will see an example. So this is a young lady who is tried dieting for her wedding or something. So completely she's in a proper exercise, and she's avoid taking much unhealthy foods. So on one night she's thinking of as the superego is like we have to do an exercise, but the idea, that means her willingness is go out to get some nice dinner with the steaks and some diet, some desserts. So what she will do? But in ego will compromise the thing like we can go for a treadmill 30 minutes and we can eat some salad and some healthy food. So like this, the ego makes some judicial benefits. And Freud came with an idea of defense mechanism, which is when the reality principle or ego is distorted in order to protect itself from anxiety or negative feeling from ID impulses. Defense mechanism can be a positive or negative ways to deal with the negative feelings. So the last part will be the stress management. So we are much aware of distress and stress because we already some of us may experience these kind of things. And my ideologies want to discuss about the use stress. That means a positive stress. So positive stress, use stress is like a positive stress has a following characters, that is motivate you and focus of energy and perceive as within our coping abilities and feel exciting and improves the performance. And the positive stress results enable concentration, improve, increase our performances and energize you into a motion and action. And for all these things, what can be done better is a stress buster. So we have to be prepared for the changes and spend some time to refresh, re-energize, and remotivate, and avoid substance abuse and a positive attitude towards a stressful stimulation in life. And don't be a complacent and try to be creative and visualization. So my core concept want to deliver to you is like physical health will be will be molded. That means you don't take much thing into your mind and worry about the future. Actually, these things all will these things will worsen your physical health too. So by doing all these kind of things, we can go for an happy family, and a happy family makes an happy society. Thank you very much.
Thank you for your presentation. Students, is there any doubt regarding?
No, sir.
Doctor, regarding this frauds no theory, you discussed about ID, super ego, and ego, and you gave some examples for no,
Yes, sir.
for a girl who, who practice, who has a desire of uh, no, uh, going out and working out and keeping herself slim, and regarding the super ego. So, is there any similar no concepts is there for people who are working in IT, who are working in no these kind of
Sir,
IT sectors? What we
sir,
can term as ID? What is super ego? What is ego?
sir, actually, I'm in our hospital. Many patients, I mean, the deceased person less than age of 30 are mostly an IT people, sir, because they are getting too much of a stress, sir. I mean, they are working in a target based, sir. So as long as they are working in a target base, they find some time to get their mental status has to be re-energized. That means they has to the person working in IT field, they are not getting adequate amount of sleep and they are not taking good care of his mental health. Sir. That is a main issue. And the Freud principle, I mean, how we are applying to IT people is like if they are getting a desire, that means the ID is like a pleasure principle, sir. So if they want to get I mean, any substance or something, the alcohol, some related those kind of things, they has to be avoided, and they should get some adequate amount of rest and sleep cycles. It should not be altered for any cause, sir. So maybe if they follow a good kind of a lifestyle, they may get rid of all those diseases in young age.
And related to the stresses, what are the different types of stresses that are there for different sectors? For example, not only to IT, but other industries. So,
Sir, I mean, the concept of stress is unique, universally accepted. So that means in each sector they have a different form of stress, but all of them may experience those kind of things. So as we discussed, the three thing is distress and stress and eustress. There is a thin difference between the distress and the eustress. So how we are taking and how you are dealing with those kind of things is matters, sir. So if you love the job and we are much aware of what all the things are going to go happening. So we are much aware of the environment. we can clearly, I mean, we can go for an use test phase itself.
Okay. And any advices to our students, because our students, they are more workaholic, they never sleep, they never take good foods. So in that case, what kind of advices you can give to them?
So, sir, I mean, in this lifestyle, I mean, while we are in college situations, we will more focus on the education, but find some good amount of good time to spend with your friends. And if you are spiritually sound, we can go for an temple or churches, wherever. I mean, the places you get your mind get relaxed, and occasionally to cinemas are hearing some good sound of musics. So completely don't involve yourself in a stressful situation. So at least you can make yourself free and study well and have fun in life. That is our that's also.
Okay, okay, doctor. So thanks for your time. Thanks for your time in the busy schedule, and no, I hope our students have understood some basics about no, mental health, stress, and other things. So thanks for joining us.
Thank
Thank
you,
you.
sir.
Thank you, students.
Thank you, sir.
Thank you, sir.